esketamine nasal spray, C3. Welcome to Spravato esketamine nasal spray, C3. In this video, you'll learn how to use Spravato. Spravato is a prescription medicine taken along with an oral antidepressant for adults with treatment-resistant depression and for depressive symptoms in adults with major depressive disorder with suicidal thoughts or actions. Spravato is not for use as a medicine to prevent or relieve pain, anesthetic. It is not known if Spravato is safe or effective as an anesthetic medicine. It is not known if Spravato is safe and effective for use in preventing suicide or in reducing suicidal thoughts or actions. Spravato is not for use in place of hospitalization if your healthcare provider determines that hospitalization is needed, even if improvement is experienced after the first dose of Spravato. It is not known if Spravato is safe and effective in children. Spravato can cause serious side effects, including sedation and dissociation. There is a risk for abuse and misuse with Spravato. Be sure to tell your healthcare provider about your complete medical history, including if you have any history of abusing prescription or street drugs or a problem with alcohol. Because of these risks, Spravato can only be administered at healthcare settings certified in the Spravato Risk Evaluation and Mitigation Strategy (REMS) program. There is an increased risk of suicidal thoughts and behavior with Spravato. Call your healthcare provider right away if you have new or sudden changes in mood, behavior, thoughts, or feelings. You'll administer Spravato yourself at a certified Spravato treatment center under the supervision of a healthcare provider who will show you how to use the nasal spray. Let's review the instructions for using Spravato now. Looking at the nasal spray, you'll see the top, nose rest, indicator, finger rest, and plunger. Each nasal spray contains 2 sprays inside, 1 spray for each nostril. Now let's look at the indicator window. 2 green dots mean the nasal spray is full. 1 green dot indicates that 1 spray was delivered. If there are no green dots, the nasal spray container is empty. Before administering your first device only, blow your nose to clear your nostrils. Now hold the nasal spray as shown with your thumb gently supporting the plunger. Be careful not to press the plunger just yet. Tilt your head back at about 45 degrees throughout the administration. This will keep the medication inside your nose. Next, insert the top into your first nostril, like this. The nose rest should touch the skin between the nostrils as shown. Before you spray, use your finger to close the opposite nostril. Now, breathe in through your nose while pushing the plunger all the way up until it stops. Sniff gently after spraying to keep the medication inside your nose. Now, repeat the same steps to administer Spravato into your second nostril. Keep your head tilted back at a 45-degree angle. Switch hands and insert the top of the nasal spray into your second nostril, making sure the nose rest is touching the skin between the nostrils. Use your finger to close the opposite nostril. Then breathe in through your nose while pushing the plunger all the way up until it stops. Sniff gently to keep the medication inside your nose. After administering Spravato, your healthcare provider will check the indicator window to ensure there are no green dots, confirming that all the medication has been administered. It's important that you rest in a comfortable position, preferably semi-reclined, for 5 minutes between devices to allow the medication to absorb. Do not blow your nose. If liquid drips out, dab your nose with a tissue. After you get your full dose of Spravato, you will be monitored for at least 2 hours. You may want to listen to music, read, or just relax while a healthcare provider monitors your blood pressure and checks for possible side effects. Other serious side effects may include problems with thinking clearly and bladder problems. After the observation period, when your healthcare provider gives you the okay, you'll be ready to leave. Keep in mind you won't be able to drive, operate machinery, or do anything where you need to be completely alert after taking Spravato until the next day following a restful sleep, so you will need to plan for rides on treatment days. Please listen to the following important safety information in this video.
Important safety information.